Good morning, everyone. I am Dr. Arpit Jindal at Global Imaging and Path Labs. Today, together, we will discuss about combined first trimester screening with the motto of early detection saves lives. Now, first trimester combined screening, NBNT scan, or level 1 scan, all three are same. It is a test which is done between 11 to 14 weeks of period of gestation. In this, there are three major components. First component is the chance of Down syndrome in the baby. Second is pre-eclampsia risk. And the third is detection of major defects in the fetus. We will discuss about each component in detail. Now, what is Down syndrome? It is a genetic disease in which the baby has low IQ and can be associated with some body defects and occurs in 1 in 700 birth in general and is the most common genetic reasons for mental retardation. What is this genetic disease? There is increase in the chromosome material. Every human being normally has 23 packets of chromosomes, and when there is extra genetic material in the 21st chromosome, it is known as Down syndrome or trisomy 21. The next question comes is, who all can get this Down syndrome? It is a nature's accident and there is no particular reason and can happen in any pregnancy, either your first pregnancy or the last pregnancy, and can happen in mother of any age. However, if the age of the mother is more than 35 years, the chance to get Down syndrome is more and the family history need not be present. Now, what does this mean? Suppose someone has a patient of Down syndrome in their home. It does not mean that they will have Down syndrome, or vice versa, that no one in the family has Down syndrome, but this baby can have Down syndrome. The next and the most important question is, can we detect this Down syndrome before birth? Yes, definitely we can detect, and not all fetuses can be seen. 9 out of 10 fetuses can be detected by third month of the pregnancy itself. It is a two-step testing. First, we do a detailed ultrasound to check for the nasal bone and the fluid behind the neck, that is NT, and other soft markers. Along with that, we also take the mother's blood on the same day and test for some markers like beta HCG, PAPE, and PLGF. And when we combine the two reports, we will get a risk. Now, how to interpret this risk? If the risk is high, that is the baby has chance of Down syndrome, then it comes as screen positive and we need to confirm the diagnosis by doing a direct testing like amniocentesis or CVS. However, if the baby has low risk, that is screen negative, then we do a target scan at 20 weeks. Then comes the second component after detection of Down syndrome, that is detection of 70% of the major fetal defects, which can be ruled out as early as 13 weeks. And the defects can be of brain or face, stomach, kidneys, heart, or legs. All these can be detected. Now, the third component is pre-eclampsia screening. Pre-eclampsia is a condition of the mother. It is not related to the baby. In this, the mother has increased blood pressure and has swelling of legs and feet. So, after doing a ultrasound for uterine blood flow, clinical history of increased blood pressure, and maternal blood sample for PLGF, a report comes as low risk or high risk. If the report comes as low risk, we can do a routine clinical care. However, if the pre-eclampsia risk is high, that is more than 1 in 100, we advise aspirin 150 mg at night, and it has a 82% reduction of pre-eclampsia risk less than 34 weeks. So, this combined blood screening test or anti-NB scan is very important for both the mother and the fetus and helps in preventing problems which can happen in late in pregnancy. And it is one of the best screening tests for these diseases and has 95% sensitivity and is better than quadruple screening test. Thank you.